You're watching North State Health, the North State's first local health program.
Good afternoon, I'm Tim Mapes. Thank you for joining us for North State Health, the only show dedicated to bringing you the information you need to live a healthier and happier life. Our guest today is Dr. Ray Powell from Physicians Plan Weight Management. Dr. Powell, welcome. Thank you for being here today.
Thank you for having me.
We always like to start with just you telling us a little bit about yourself, how you ended up coming here to the North State, and how you ended up getting into medicine.
Well, I have a different pattern of life when it comes to medicine. I was actually in the military for about 11 years, flying and jumping out of airplanes. I was in the F-111 and the C-141, and I ended up getting injured in Desert Storm, so I became a disabled vet. And I went, fortunately, I was fortunate enough to get into medical school at Texas Tech and ended up going to 4 years of medical school and 3 years of residency in emergency medicine. And my family lives in the North State, so I moved from where I did my residency in South Carolina to Reading in 2001.
Okay. So, I mean, I know the North State, a lot of the viewers out there will appreciate a military man, and we definitely appreciate your expertise and for bringing it here to the North State. Well, how did you get into, I mean, you talked about how you were in the military and you had a different medical specialty. How did you get into weight management? How did you delve into that side of things?
Right. What happened was when I was in the Air Force, I ended up breaking my ankle and hurting discs in my back, and I ended up a disabled vet, and so I was a year non-weight bearing on crutches. I ended up with about 27 epidural injections and 2 back surgeries. And so my activity went to zero and a lot of stress going through medical school and residency, and I ended up ballooning to about 250 pounds.
Oh, wow.
And as a doctor going through medical school a little bit later in life, what I realized was that we were never taught how to lose weight or how to deal with obesity as a disease. And I started working with my father, who's Dr. Richard James Powell, who did endocrinology as well as weight management. And we delved into that, where I started really learning about nutrition and becoming an expert in the field of obesity and really started treating myself.
Okay. So, I mean, that's important there for people to know. You have the experience that you're saying you've experienced what your patients are experiencing.
Exactly.
So I think that's very, very important.
Right.
But then also talk about the experience that you have on the credentialed side. I guess you are triple board certified. What exactly is board certification?
A board certification is pretty much a good housekeeping seal of approval by the different medical boards, and it takes a lot of additional training. For emergency medicine, it's a 3-year residency, as well as taking a written exam and an oral exam in order to become board certified. In bariatric medicine, it's hundreds of hours of continuing medical education on the disease of obesity, as well as underlying diseases like high blood pressure, hypertension, taking an exam, taking a written and oral exam, and then we even have a board member that comes to our office to make sure that we're treating patients up to the standard of the society. And then as a physician nutrition specialist, it's 5,000 hours of clinical work in nutrition, as well as a written exam.
Okay, so definitely the good doctor here knows what he is talking about, so we definitely are going to be talking about a lot today. So you are the only board certified bariatrician north of Sacramento, is that
That's correct. I'm the only board certified bariatrician as well as physician nutrition specialist. The nearest one is down in UC Davis.
Okay.
And there's only about 44 physician nutrition specialists in California.
Okay. Well, what is the difference then between, say, a bariatrician and then a bariatric surgeon?
That's a good question. A bariatric surgeon, and that's what most people hear in the general news, is that that's somebody who actually does the bariatric surgical procedure. And so it's one where that is a pretty involved procedure. There's gastric stapling, gastric bypass, there's the gastric band. What we do is we're treating obesity as a disease. And I deal with quite a few of the people that have had gastric bypass that are gaining their weight back. I deal with pre and post gastric bypass patients and dealing with their nutritional requirements before and after the surgery. And I also create a lot of the pre and post gastric bypass nutritional plans for surgeons across the country.
Okay.
But then we also deal with the person who needs to lose 100 pounds all the way down to 10 pounds. It can be a very medically needed weight loss versus even a cosmetic weight loss.
Okay. So what exactly is a difference between, a bariatrician and a physician nutrition specialist?
Right. With a physician nutrition specialist background, what I can deal with is people that need to not only lose weight, but also gain weight. I deal with cancer patients on chemo. I deal with end-stage renal disease patients. We deal with weight gain, extreme athletes. We deal with a lot of different medical conditions where we can help treat the disease with nutrition.
And you are a member of quite a few societies and organizations, right?
Right, exactly. I'm a member of the American Society of Bariatric Physicians. That's the board certification for that. The American College of Emergency Physicians, the American Medical Association. Since I'm a veteran and was in Desert Storm, I'm a member of the Veterans of Foreign Wars. And I also do aesthetics within our practice, so I'm also at association with several of the different aesthetic associations as well.
Okay, so I know a lot of people think of your practice and they think of weight loss, so that was something there that you just mentioned. It's physicians plan weight management. It's managing it so it can be, you know, people trying to gain and lose. So tell me a little bit about physicians plan weight management and exactly what that is.
Right, and what we do is we pretty much treat the whole person. So we're looking at an issue of their medical diseases. We look at the individual, looking at what they're doing right and what they're doing wrong, and we treat it as an individual process with multiple disease processes. And we have to really adjust medications. We deal with their primary care doctor to make sure that we're adjusting things when their diabetes is you know, the requirements for their insulin is decreasing or their high blood pressure is coming down, and they don't need as much of the medication. But I'd much rather also have somebody who only has 20 pounds to lose to come in and have it medically managed off than to go and do some crazy over-the-counter diet that's really dangerous. So we really do manage. It's not a weight loss, more that it's having them understand how to get the weight off, but then keep it off.
Okay, so that's where the difference is going to come from, say, you know, a diet center where all they're specializing in is losing weight, or or a personal training center and that type of thing.
Right, and people can lose weight, but my major thing that I educate the patients on is what weight are they losing? Are they losing fat weight or muscle weight? And when somebody loses 40 pounds in 30 days, I can tell you right now it's not all fat. It's going to be where they're wasting muscle mass. So then it becomes an issue of making sure we're getting the right weight managed off.
All right. Well, Dr. Powell, thank you. I think the viewers out there can see why exactly it may be so important for them to come see you at Physicians Plan Weight Management and what you have to offer them. We're going to take a quick break, but we do still have a lot of information to get to here on North State Health. Coming up, you have a few extra pounds. Are you obese or are you simply overweight? We're going to look at that difference. So stay with us. But for more information on today's topic or any edition of North State Health, you can just go to our website at krcrtv.com/North State Health. You can watch today's episode in its entirety from your computer or laptop. We'll be right back.
Welcome back to North State Health, the North State's first local health program.
Welcome back. Our guest today again is Dr. Ray Powell from Physicians Plan Weight Management. Dr. Powell, let's get right into our topic and not waste any time. Let's talk about the difference between being overweight and being obese. Kind of walk us through that.
Right. There's three different ways of defining obesity versus overweight. The first one is what you see in most doctors' offices, which is called a body mass index. The second is waist circumference, which I'll go through the definition, and also body composition, which is the most accurate. But most people see the slide of a body mass index where it shows height against weight. And this is actually one of the most inaccurate ways of looking at somebody's weight because it doesn't take into effect male or female or muscle mass, but it's a general guide. And so what they talk about is from 19 to 25 is considered normal weight, low risk. 26 to 29 is overweight. 30 is obese, 35 is morbidly obese, and 40 is extreme obesity. So if you're way over in the red, yes, it can show some major issues, but for men it can be inaccurate in the yellow and the red area. But the risks, according to that, is when you get it to 29 or higher, your diabetes risk go up 27 times, high blood pressure and heart disease 3 to 5 times, stroke is elevated, 9 cancers are tripled, the list goes on and on. And with mortality and obesity, you can see on the slide that as the body mass index goes higher and higher, you get a very high risk for death rate. But the next one, which is actually more accurate, is measuring the waist circumference. And that's measuring at the belly button with your breath being just at normal level. You measure it right at the belly button, and 35 inches or greater for women puts them at a very high risk. 40 inches or greater for men. So that's something somebody can do right at home. And it shows that they've got a large central obesity, which is the picture on the left, shows a 250-pound human. And the obesity in the center of the abdomen is which actually is the most inflammatory fat, which causes major health issues. The picture on the right is a 120-pound human, and you can see that there's very little fat around the intestine or the organs.
All right. Well, thank you, doctor. We always like to give people, you know, something to do at home. And when you mentioned that the BMI, calculations is something that we've all seen in, gym class and those type of things, that it not being as accurate, that's really some good information that, people can do at home. And you were saying with that BMI chart not being, as accurate as people may think, I mean, that could be, you could have a 5'6" person who's extremely stocky and strong and all muscle, and could they potentially weigh that they are obese?
No, well, it could. On the body mass index, it could show that they're obese, but they have such a good muscle mass that it's really not accurate for men or people that are very athletic.
Okay, so definitely just do that, the waist thing, and if you fall in those numbers, 35 or greater for women and 40 or greater for men, you have a problem. You may need to make some changes.
Well, and the third way we use is what's called a body composition, which is a machine we have in the office that actually shows their body fat percentage very accurately, and we use electrical impedance for that, and it shows a very accurate description.
Okay. All right. Thank you, Doctor. Well, when we come back, we are going to talk about, the epidemic of obesity. I believe it is an epidemic here in this country, and so we're going to have much more on that when North State Health comes back right after this 1-minute break. Stay with us. And we are back with Dr. Ray Powell from Physicians Plan Weight Management. Our topic today is talking about obesity. And Doctor, let's talk a little bit about how big of a problem is this? Is it truly an epidemic, and is it getting worse?
It truly is. It's more than doubled in the last 20 years. And really, when you look at the statistics, over 400,000 people in this country are dying just directly related to obesity as a disease every year in this country. And you see it every day in the press. You see all the different magazines. They talk about childhood obesity as well as adult obesity, and it just causes so many other medical conditions that are worsened. And if you get the weight under control, a lot of times those disease processes like hypertension and diabetes actually diminish.
And you were saying earlier before the show, I think, that Americans, we always want to be number one, we want to be best. Well, we're number one, but we shouldn't be. So.
Exactly. And the next slide, we show the different countries, and it's really the top 10 countries and the prevalence of obesity. It's 30% of the American population is not overweight, it's obese. About 60% are total overweight. And you can see Mexico, England, United Kingdom, Greece, Australia, and now it's rampant into the Middle East as well as into Australia. Okay. It's really a major epidemic that's becoming a pandemic according to the World Health Organization. Okay. And this next slide shows a progression of the disease of obesity as these colors go. The light blue, the dark blue, it's getting beyond into the deep south where there's more and more obesity, up to 10 to 15 to 20%. Into the 90s now, we got a new color, which is greater than 20%. Now you can see it just almost spreading like the flu across the country. Now there's even a higher percentage of 25% in the deep south and industrial states. And then it becomes even more rampant, and this is into 2007 to 2009. It's even gotten worse up to 2012.
Okay. With seeing all of your patients, what would you attribute that to? Is it simply the whole supersize me thing, or is it?
It's a combination. Most people describe stress, and I always tell them stress has no calories. It's what we do with the stress, and it's everything from inactive lifestyle. It's disease processes. There's a lot of medications out there that cause weight gain. It's injuries. It's the low lifestyle activity of driving everywhere when you could walk a half a mile to the grocery store. It's the sedentary lifestyle, not to mention genetic predisposition. And that a lot of people give a lot more credence to that when it's only maybe 5 to 10%, but then it is the supersize me. It's the dense calories that we're getting into that we really don't realize. And that's called food and liquid amnesia.
Okay.
It can be really dangerous.
And talk about a pretty sobering number, about the number of deaths in the United States every year from this.
Exactly, 400,000 deaths per year just on their death certificate, complications secondary to obesity. Okay. And so it's becoming a really rampant disease process.
Yeah, and that's one of those statistics that a lot of people say that the different diseases that are out there, or when there's social society problems where people die from certain reasons, that there's an outrage about. That if this were something else, if this 400,000 people dying from a plane crash, it would be absolutely amazing.
It would be stopped in one day, and it's really costing now billions in the medical healthcare as well as in the industrial workforce for it to be an issue of major complications for the cost of living in this country.
Okay. Well, Doctor, we always talk about, we've talked about the problem in great detail, but now we have viewers out there, maybe they're going to do the test that you were talking about of measuring your midsection, and they realize they have to make a change. So in the next segment, when we come back, we're going to be talking about what people may be doing wrong if they have not had success in losing weight, and some of the things that they can do in addition to coming and seeing you as well. So that's going to be coming up in the next segment. You're not going to want to miss that. So just go ahead and stay with us. We'll be right back after just 1 minute. And we are back with Dr. Ray Powell from the Physicians Plan Weight Management, and we are talking about obesity and being overweight. So, doctor, a lot of people out there, they get frustrated. They want to lose weight, but they just can't seem to. What exactly may they be doing wrong?
Right, it's where the first foundation is. They have to understand that if they have the diagnosis of obesity, it's a disease. It's been defined now by every single medical society as a chronic relapsing medical disease, and it has to be treated like one. Most people will try to do it on their own. They'll try to go exercise, they try to cut back, but they get very frustrated by the time they come into this because they've been trying all of that and they don't lose any weight. So what we have to do is we have to actually go through and really make sure that they're really understanding what they're doing right and wrong. And then we manage and give them specific patterns of what to do with food and making sure they're getting adequate nutrition in.
Okay, and you said what they may be doing wrong. What are some of those misconceptions about weight loss that they can, what is it, that they can take a pill, these fad diets? Or?
Exactly, so many people are so desperate to lose weight that they'll try all kinds of different fad diets. And there's everything from the 3-day diet. Well, what happens after 3 days? You know, there's even one that's the most extreme I've seen recently is the tapeworm diet, where they actually order tapeworms and they take them and have themselves infected with tapeworms until they lose some weight, and then they try to take anti-parasitic medicines to get rid of the tapeworm.
That's lovely, isn't it?
Right, it's just crazy. And then we've got, you know, the green coffee, you've got the raspberry ketones, which are not a weight loss entity. They might help in a little bit with the metabolism, but they really don't go into any major issues with weight loss, so to speak. They just wasting their money.
Okay.
And I've got some examples of some that I brought here that are kind of in the news right now that a lot of people are doing that I just want to kind of, you know, pop some myths that people do. So one of the ones is this one. It's called the HCG diet solution. And HCG is a hormone. It's the pregnancy hormone. It's called human choreographic gonadotropin. And they buy this over online or at a drugstore, and they're supposed to put it under their tongue, and suddenly they're going to lose weight. But what most people do is they're put on a 500 calorie a day diet, which is starvation. The unique thing about this one is when you look at it, it says HCG, which is a hormone, but at the top it says hormone free. Well, how can it be a hormone if it's hormone free? And they spend about $80 for it, and they don't lose any weight, and they bring it into me.
Oh, wow.
Another one that's really scary is this one, which is growth hormone supplement. Everybody's into the growth hormone, and when you look at it and you look at the ingredients, it's bovine growth hormone that's been desiccated into a powder.
Oh, wow.
So what is bovine? It's cow. So how are they finding the pituitary gland in a cow, cutting it out, pulverizing it in a powder, and then you're supposed to take it? Well, what happened to mad cow disease and all these kind of crazy things that people get into, and it really doesn't make them lose weight, and then they get very frustrated because they spent $45 on it.
Okay.
And so we really try to educate them that those things just don't work. It's got to be, we really have to address the major issues that they're doing with food.
Okay, so we're looking at those, and we're talking about the fad diets and some of the supplements that you can take, and that's what people are doing wrong. What would you recommend to your patients or potential patients that they can do? What are some of the tools? They've
got to really understand what they're putting in their body. You know, again, everybody hates the term food log, but one of the things that really has them understand what they're doing is actually logging what they're doing, but they have to have an expert in the field that can show them what is the food log. You know, a lot of people do food logs for themselves all the time, and they use apps on the telephone, but they really don't know what it's actually supposed to look like, and that's where our expertise comes into it. But one of the major things we find is about 90% of our patient load, they don't eat. And we've got to teach them how to eat. We have to understand what they're doing right. We've got to get them into a muscle memory of understanding they have to feed the body. And then they have to go into really understanding stress management. They have to understand when they see the weight coming off that it really works by actually getting in some nutrition and feeding the body. They have to move their body, they have to do some exercise, but not extreme. But then it comes down to a point of surgical intervention, accountability, and the biggest thing is education. It's really teaching them how the body works with them versus against them, and so can food.
Okay. So you have a patient out there that maybe they start the food log, they start an exercise program and this and that. What are some of the keys that they can do to be successful and stick with it?
Right, it's making sure that they don't get tired of what they're doing.
Okay.
People will start a particular diet, but what happens when they get tired of it? They fall back to what they were doing before. So what we try to do is teach them multiple different ways that they can lose weight. That way they can move around between them. And that way they don't get the dieter's fatigue, but we make sure that it's medically safe and that they're losing the right weight, not the muscle, but the fat.
Okay, it's kind of like when you're working out. They say you have to switch up the routine or your body gets tired of it.
Exactly.
So. All right, thank you, Dr. Powell. That's about it for this edition of North State Health. We are going to take a quick break and then wrap up with the good doctor, our today's guest. So stay with us just after 1 minute. Thank you for joining us for North State Health. Join us each week at this time for another edition of our show. For more information on our program, you can simply go to krcrtv.com/North State Health. There you will find information on all of our doctors, tips from the experts, and you can watch entire shows from your computer. And that is very, very important because, as Dr. Powell was telling us, on your website, when you find links to Dr. Powell's website, it's so important to get information and be educated, but to get the right information, and you have links on your website to do that.
Exactly. We really stress education and really understanding that obesity is a disease and that you can get really sick if you don't do it right. So on our website, which is physiciansplan.net, there's a lot of information on there that really educates the patient on what we do and how we treat obesity as a disease.
Okay, and again, you wanted to emphasize that's physiciansplan.net, not .com. So, but again, those links are on the krcrtv.com/North State Health, so it's very easy to find. And Dr. Powell, say somebody is interested in, being treated. Where's your practice located? How can they get a hold of you?
Right, we have 6 offices. So I have offices Wairika, Mount Shasta, Redding, Red Bluff, Chico, and Willows.
Okay.
So on the website, it has the location button that they can pick the location they're in, and it goes right to the phone number and the location and even a map of where our offices are.
Okay, and it can start with just people coming in and getting an evaluation of where they're at and what you can do for them?
Right, exactly.
All right, well, thank you, Dr. Powell, for being here
Thank
today.
you.
We appreciate
it.
And that about does it for this edition of North State Health, but we will be back next week. So until then, we'll see you then and have a great week.